Hi, I'm Star Jones, and welcome to the Star Treatment. Over the last 25 years, I've had the privilege of showcasing interesting people. Everyone who is anyone, from the famous to the infamous, presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some wonderful everyday people. Today, I'm proud to introduce you to Dr. Evelyne Davidson, who became a doctor to give back to her community. Growing up in Knoxville, Tennessee, Evelyne Davidson, MD, observed that her hometown lacked a specialist who could properly help the many people around her who struggled with high blood pressure, diabetes, and heart disease. Further propelled by her parents, she has since dedicated more than 30 years to primary care, patient care and management, and internal medicine. Her father, Dr. Evelyne V. Davidson, was a surgeon who often took her to work with him in the hospital and took her on house calls. And her mother, Esther J. Davidson, was a nurse who encouraged her to not follow in her footsteps, but instead become a doctor so she could give orders and not take them. Dr. Davidson attributes her success to both of them. Dr. Davidson has found success as a medical director of the Knoxville office of Smoky Mountain Hospice and a principal investigator at New Phase Research and Development since 2011 and 2013, respectively. In the latter post, she has conducted more than 30 clinical trials and performs protocol-dictated examinations, all while meeting with each subject at every visit and maintaining an active role in the day-to-day coordination of each trial. Prior to this, she served as a physician at Premier Medical Associates from 1998 to 2009 and at Baptist Primary Care System from 1994 to 1998. Although it was difficult and time-consuming, Dr. Davidson gained pivotal experience in her field when she went into private practice with her father between 1990 and 1994, during which time she enjoyed getting to know patients on a personal level. She began her professional journey as an intern at New Hanover Memorial Hospital in Wilmington, North Carolina, from 1987 to 1988, before completing a residency in internal medicine at the hospital in 1990. Before embarking on her career path, Dr. Davidson was the first African-American valedictorian at Knoxville Catholic High School in 1979. She subsequently pursued her formal education at Vanderbilt University's School of Engineering, earning a Bachelor of Science in Biomedical Engineering. Dr. Davidson then concluded her studies in 1987 after receiving a Doctor of Medicine from the James H. Quillen College of Medicine from East Tennessee State University. Outside of her myriad of primary endeavors, Dr. Davidson has remained affiliated with numerous professional organizations over the course of her prolific career. She has served as a member of the American College of Physicians, the American Medical Association, the National Medical Association, the Tennessee Medical Association, and the Knoxville Academy of Medicine. In addition, Dr. Davidson is heavily involved in the Links Incorporated, a service organization consisting of more than 16,000 professional women of color in 288 chapters located in 41 states, as well as the District of Columbia, the Commonwealth of the Bahamas, and the United Kingdom. This group is committed to helping the underserved, especially in the African American community. Members, including Dr. Davidson, participate in cultural activities and educate children about the arts as well as current events. Dr. Davidson has always strived to be a role model, especially for young African American women. She has tried to help them understand that no matter where they came from, it is possible to attain higher education and become a successful professional. A strong believer in the old saying, "To whom much is given, much is expected," Dr. Davidson has done her best to return to the community from which she came to give back to the people. Dr. Davidson is presented on billboards advertising hospice care throughout her town. She believes that hospice care would have been helpful in the time before her father's death in 2010. However, neither she nor her family knew it was available, as they were not informed about it. Dr. Davidson had the opportunity to contribute her expertise at a hospice office in town, and she decided she wanted to help people and families cope with the dying process. Upon reflection of her life and community, Dr. Davidson sees it all as being fulfilling. However, she recognized that she had to overcome several obstacles in the face of pursuing her goals, as both a female in a traditionally male-dominated field and as a minority. She advises future generations that they must be willing to do the work and make sacrifices for which they will ultimately be rewarded. Dr. Davidson would like to be remembered by her peers as somebody who set a goal, reached it, and continued to persevere in spite of the odds. Additionally, she hopes her legacy is that she always put her patients first. She believes that what has separated her from others in the field is her ability to build great rapport with her patients, often through her sense of humor. Looking toward the future, Dr. Davidson plans to remain in her current positions. That was Evelyne Davidson, proudly presented by the Star Treatment and Marquee Who's Who. I'm Star Jones for Marquee Who's Who, profiling the leaders of American society, men and women who are contributing to our nation's development and achievement. Stay tuned to this channel for more interesting features on truly exceptional people.